name is Sarah Allen, and in this presentation, I'll be sharing the preliminary findings of a recent Vet Compass study investigating the use of protected antimicrobials in UK equine practice. This work was funded by the RVC Mellon Fund for Equine Research and RCBS Knowledge. Ethical approval was obtained from the RVC's Clinical Research and Ethical Review Board. In addition, the overarching aims and methods used by Vet Compass have been reviewed and are supported by the Royal College of Veterinary Surgeons. The sharing of animal or owner-related data with third parties without prior owner consent is normally prohibited. However, the RCVS concluded that for large-scale projects such as these conducted in the public's interest and not for commercial gain, and in which no owner or animal identifying data are obtained, consent may be given by default, so long as the collaborating veterinary practices promote their participation in the project and an opt-out function is available for owners not wishing to share their information. I would like to thank the RVC IT team and Eclipse Veterinary Software for their technical support and the collaborating veterinary practices for their willingness to contribute data to this project. Antimicrobial resistance is an increasing threat to human and animal health. Concerns have been raised regarding the potential mis- and overuse of antibiotics in veterinary species with inappropriate and frequent antimicrobial use, known promoters for the emergence of resistant bacterial strains. With increasing scrutiny surrounding the veterinary use of antimicrobials, several professional bodies have promoted the concept of antimicrobial stewardship, which encourages their responsible use. The surveillance of antibiotic use, particularly for the protected classes, is a fundamental component of stewardship. Little is currently known about antimicrobial use in UK horses. Annual sales figures produced by the Veterinary Medicines Directorate provide some insight, but give no indication as to the number of horses prescribed antibiotics, how much they are treated with, or the reasons why. The aim of this study was to use real-world antimicrobial prescription data housed within veterinary electronic patient records to describe the use of protected antimicrobials in UK equine practice and identify risk factors for protected antimicrobial use in horses receiving systemic antimicrobial therapy. Bespoke software was embedded into the practice management software systems of 5 UK equine veterinary practices to control the automated extraction of anonymised electronic patient record data and their transfer to the secure Vet Compass database. The collated records were reviewed and a study population formed of all equids attended by the 5 practices over a 12-month period was created. Within the database, each invoice product or service is stored as a single row of data, which details the item name, the amount supplied, any relevant dosing information, treatment dates, and associated animal and veterinary practice ID numbers. A table of terms related to the prescription of systemic antimicrobial products was created based on their associated charges, and a database query then run to extract all data rows corresponding to the supply of these products to the study population during the study period. Systemic antimicrobials were then classified based on their active ingredient, class, and BEVA's protect me status. The data rows for each animal were then combined into individual antimicrobial courses, which aim to include all products used in the treatment of a single clinical problem. The number of horses receiving systemic antimicrobials and protected antimicrobials was described by counts and percentages with 95% confidence intervals calculated. Similar descriptive statistics were produced for courses. To obtain information on the primary reason for use, the electronic patient record for each horse that received a systemic antimicrobial was read via the Vet Compass clinical coding app and the primary reason for prescription noted. Reasons for use were then grouped by body system affected, with a separate category reflecting prophylactic use. Demographic data and information relating to the use of culture and sensitivity testing, hospitalisation, and horse use was also extracted from the database. Multi-level mixed effects logistic regression modelling was used to explore risk factors for protected antimicrobial use. 2 models were created. The first included all horses receiving systemic antimicrobial therapy, with the second restricted to those that also had complete demographic information available. Post hoc power calculations estimated that these models had 80% power to detect an odds ratio of 2 or more with 95% confidence. A total of 28,994 horses were attended over the study period. Of these, 5,524 received at least one systemic antimicrobial, of which 8.8% received a protected product. Of the 6,441 antimicrobials identified, 8.2% included a protected antimicrobial. Where protected antimicrobial courses were made, the protected product was used as first-line therapy in 70.1% of cases. The most commonly used protected antimicrobial was fluoroquinolones, used in 256 courses. Culture and sensitivity was performed for 5.4% of antimicrobial courses overall and 19.3% where a protected antimicrobial was used. The top 3 indications for protected antimicrobial use were skin complaints, respiratory disorders, and prophylactic use. On this slide, I'd also like to point out that a reason was not provided for nearly a quarter of cases. Similar patterns of association were seen across both risk factor models. The odds of protected antimicrobial use were at least 4 times higher if the horse required hospitalization, with this likely reflecting more severe disease in these patients. Age was treated as a categorical variable with cutoffs based on rounded quartiles. Odds of protected antimicrobial use were at least 2.5 times higher in the youngest age group of 0 to 4-year-olds compared to those in the 5 to 8-year-old group. In part, the greater use of protected antimicrobials in young stock may reflect a desire to avoid severe complications in the sick neonate. However, this observation may also be driven by the large number of young racehorses in this study population. Horses receiving systemic antimicrobials for a respiratory problem had twice the odds of being prescribed a protected antimicrobial compared to those treated for a skin condition. The use of antibiotics for the treatment of respiratory conditions may or may not be warranted, and further work would benefit from considering infectious and non-infectious conditions separately, although it was not always possible to determine the underlying etiology based on the information contained within the record. Encouragingly, prophylactic use was associated with a 70% reduction in the odds of protected antimicrobial use. Protected antimicrobial use was also found to be greater in both racing and non-racing thoroughbreds. The low row values indicate that little of the latent variation in the odds of protected antimicrobial use was attributable to veterinary practice, with the majority of the variation accountable by horse. This study has provided valuable insight into protected antimicrobial use. Limitations include the quality of clinical record keeping. Full assessment of dose rate, duration, and appropriateness of treatment could also not be made based on the quality of recording. The small convenient sample of veterinary practices taking part may also have introduced bias, and further work would benefit from including a greater number and a more varied selection of practice types. In conclusion, veterinary electronic patient records can be used for the surveillance of antimicrobial use. The empirical use of protected antimicrobials remains commonplace. Further work is needed to understand the drivers for protected antimicrobial use, particularly in those horses identified at increased risk, and those that are limiting culture and sensitivity testing. Thank you for your time, and I'm happy to take any questions.